Welcome to the Catalyst Podcast. I'm your host, Charles Epstein. Joining me today is Police Chief Mike Fillback, who has been with the Edwardsville, Illinois Police Department since 1996. During his tenure, he has served as the Patrol Commander, Support Services Commander, Deputy Chief, and was appointed to the position of Director of Police in 2021. Chief Fillback has a bachelor's degree in business and a master's degree in public administration from Southern Illinois University, Edwardsville. He graduated from the Northwestern University Center for Public Safety Staff and Command in 2009. He serves as president of the Southern Illinois Police Chiefs Association and as a board member for the Madison County Child Advocacy Center, Metropolitan Enforcement Group of Southern Illinois, and the Southwestern Illinois Law Enforcement Commission. Police Chief Fillback, welcome.
Thanks for having me, Charles, and you can just call me Mike.
Oh, excellent. Thanks, Mike. So good to have you. I really do appreciate your taking the time. My understanding is, just to give people a picture, sort of a postcard image of Edwardsville, is that it's a college town and a county seat with more than 26,000 residents. It's a blend of historic neighborhoods, newer subdivisions, a charming downtown, and an array of commercial development, services, restaurants, and retail. Is there anything I am missing, Mike?
No, it's a great community to raise your family in. And my wife and I, we've been here my whole 30-year career in town. So we've raised our kids here. It's a nice community, very bikeable, walkable community. So we've enjoyed our time here.
Very nice. Before we get to it, I should like to ask you, I'm always curious, what drew you to police work?
I grew up in an area just north of Edwardsville in the Alton area. Had a family member as a kid that I recall working for the Alton Police Department, and just kind of from there, just kind of always had that in my mind that was something that I wanted to do. The opportunity to kind of make a difference in your community. And so that's kind of what drew me here. And like I said, Edwardsville is a great community, great school. So catching on with the Edwardsville Police Department was just a lot of luck, I guess. But it's been a great thing for our family.
Excellent. By the way, what would Plan B have been?
Work for another police department. Actually, I got the business degree at the time, kind of through high school, and that I worked at a health club and was kind of leaning towards like management of some sort or banking. When I actually got hired here, I was interviewing for like insurance companies.
Oh, interesting.
A little bit different, but hey, you got to have a plan B because
you do.
You never know what's going to happen.
So yeah, let me get to it. So, law enforcement is often first on the scene for behavioral health crises. I'm not sure that a lot of people understand that. They view law enforcement doing other things. So let me ask you, how does the Edwardsville Police Department handle these calls, and why has this role become so central to modern policing?
Yeah, so many years ago, the state of Illinois started a program referred to as CIT, Crisis Intervention Training. And so one of the things for years that we tried to do is make sure all of our officers go through that training with the state, and that way that they're more knowledgeable on how to approach situations. So, like you said, we are typically first on scene, and that because when somebody sees something occurring, you don't necessarily know what is going on. So you don't know if that's somebody maybe breaking into a house or somebody having a mental health issue that's causing them to do damage to something. So we do a really good job, I believe, our officers do, of approaching these situations. We try not to only make sure that the officers have that training, but also that we're always going to have here, we always try to have at least a couple of officers working in these situations. A lot of times you'll see 2, maybe 3, maybe 4 officers dealing with an individual. And that is for the officers and the individual's well-being, because it gives us an opportunity to safely if we need to take that person into custody, to safely do it without having to overestimate our abilities as an individual, and then get them the assistance that they need. Our officers do a great job of usually, in most cases, talking people, if they do need to go to the hospital, talking people into those situations to try to seek some of that assistance, on their own.
Are these skills these days taught at the academy level, or are they acquired once they join your department?
It's kind of, it's something that's a lifetime learning. So you learn some of these skills in the academy. There's also regular classes that you go to for these things, and then there's things that, whether it's your supervisor pointing things out to you or just annual trainings that we do at house, there's something that is constantly being emphasized and looked at annually, because none of us are going to be perfect at these things. Police officers have to do a lot of different tasks. We don't just handle any one crime. We're not really specialized in any one thing, but we have to deal with all these things, and we're expected to deal with them professionally. And that, so we do try to emphasize those trainings and that mentality throughout the year.
In preparing for this conversation, I came across a stat. I don't have it at my fingertips. So I'm very surprised to learn that a relatively high percentage of 911 calls have to do with a mental health, behavioral health crisis. Is this becoming more and more understood in the community that policing these days, greater and greater degrees, has to do with that?
Well, I don't know per se that the community realizes that, but and I don't have the numbers. I didn't look up the numbers, but I'd say that it is more and more a thing that we deal with. It is a growing trend that we do receive a lot of those calls or reference that. A lot of times they're repeat individuals involved in that. So it is something that you try to, when you're onboarding people and you're training people, you're reminding them that this is a big undertaking, that we do handle these calls, and make sure that they're aware of how the expectation is to handle resources available, etc., so they can do the best they can.
So getting to greater specificity, what are some of the biggest challenges your officers face when responding to someone in a mental health or behavioral crisis?
Obviously, anytime you're responding to a call, until you get there and you have the opportunity to actually see what's happening, you cannot take for granted anything. Even if you've dealt with somebody over and over again, you cannot get complacent with that call, because that could be life or death ultimately if you take these things for granted. You have to, you always want to be professional and try to get individuals the help they need, but you also have to make sure that you're doing it in a safe manner for all involved. The other thing that we've always faced is resources available. We can get to somebody, we can talk to somebody, and we cannot just make you go unless you meet certain criteria. And then sometimes even when you meet that criteria, or maybe you're willing to go talk to somebody, sometimes resources just don't exist, or they're not plentiful enough to get you and keep you. Because there is no just go talk to somebody today and you're fixed. This is a long game here, and resources still today, just aren't always available.
I asked you about perception in the community about these kinds of services or this kind of approach. But I'm thinking also on the ground, those perceptions have or can potentially have real consequences. So, for instance, if somebody's experiencing a mental health crisis and they're approached by somebody who's clearly a social worker, the response can be different as opposed to somebody in blue, in uniform. They may recoil. There's a different expectation. I'm assuming that that also can create some tension and difficulties.
I mean, it can, for us, we do partner with Chestnut. So we have somebody that we bring in for, a couple days a week that, will ride. But, typically in these cases, we are responding. We don't have anybody dressed down, and that we have to respond in our uniforms and that. And like I said, the officers do a fantastic job here, with de-escalating those things. And sometimes some of the officers have, rapport with folks that those folks don't even want to talk to somebody else. They want to talk to Officer A, or Officer B. They have in some cases, they have their favorites. As far as, our partnership with Chestnut is designed to try to follow up, because we don't have the ability to have somebody here around the clock, and we wouldn't expect them, to respond to an unknown situation, to begin with, because we want them to be safe as well. So what we do with our worker is, if she is here, if the officers respond and they, once they know that it's safe, then she'll come in and she'll talk to this individual, and follow up with this individual and offer, resources and things. But then, like during the regular week, we will look at folks that we're dealing with and refer. So when she does come in, we'll be like, hey, we dealt with Charles a couple of times this week. The officer that's got you today, I'd like you guys to go by and try to make contact with him, follow up, and see what resources we can provide. We're not looking for instant gratification. We know that it's, like I said, it's a long game. You have to want assistance, be open to that, and it's not going to happen overnight, typically. So we're giving her the ability to try to build that rapport and that, so that over time, hopefully she's able to get through to some folks and get them, hooked up with the assistance that might benefit them.
Or have your crisis response strategies over the last, I don't know, 5, 10 years changed? Have you had to adapt to different circumstances? Whatever changes are afoot, is there anything you can point to where you had to all of a sudden adjust some approaches?
Well, I mean, as far as the training and that we provided, our approach has been relatively, similar for a long time, because we kind of tried to make that a priority with the training, so that we knew what resources, as much as we could, what resources were available, and what to look out for, and how to best deal with individuals that might have, certain conditions. With Chestnut has always been available to us, just not our partnership directly with them. Now, with having somebody that's assisting us is relatively young. It's about 6-7 months. So it's really too new to really say, like, is this having what impact it's really having? But, that it is one of the things that we've looked at is, hey, this was something that over the last few years might be helpful to us. So we should give it an opportunity and see how this might work. And if down the road, if we need to make changes, we need to add to that program, or, bring on, somebody else to assist as well. We'll do that, but we're just kind of still in the, infancy stages of doing this particular program.
Is there anything you can point to, any story, any trend line that encourages you that this is the right path, or are there any significant impacts from this collaboration with Chestnut?
Yeah. Really, again, some of the folks, the more transient folks you see, a lot of times, they change up and they're harder to get a hold of. And that's so we have her working on some of those folks, and that's still there. There are a few stories there where she has connected a few people with drug treatments, and that probably right now I guess one that you look at and say, hey, this is having a positive impact. So not everybody that has issues, or without a home or even without a job. We have people that's in the community that have a home. They have other issues that sometimes brings us to their home. And, in one particular case, a lady that has a hoarding issue that we've dealt with for a long time. And our Chestnut cooperation here has connected her with some resources, got her into a program that specializes in that particular health issue. And, now long term, you don't know the outcome because this is just kind of new, but they've helped her get some things cleaned up, and she's got some sessions that she's going to. And she has been open to meeting with our Chestnut worker and that on several occasions, which is positive because really all we were accomplishing in the past was kind of getting bare minimum done, and it wasn't really benefiting her. It was taking care of some issues that was the reason for the calls. But in this case, hopefully we're not only taking care of that issue for the neighbors, but we're addressing, hopefully the long-term benefit of the individual resident and that. So right now, and outside of that, the lady, just the regular citizens, and not somebody that is displaced or somebody going out and causing other issues with people or anything. She needs some help and is stuck. And hopefully we've got her connected now. She's on a different path.
So it seems thus far, some of this stuff is still relatively new. So a lot of these success stories are anecdotal. What are the broader success factors you'd like to see 1 or 2 years down the road to indicate, yes, this is a great program. This is working. This is the future.
Well, I mean, obviously, a lot of the people that we deal with on a repeat basis that are more maybe they're getting trespassed or causing damage places and that we want to get them into assistance. So, hopefully a reduction in some of those folks and connecting them with help that's to better, their circumstances and are well.
What advice would you give other police chiefs or community leaders who want to build these collaboration? What's the next frontier for law enforcement in behavioral health response, in your view?
Well, I mean, it's, industry wide, we have to recognize that as much as a lot of folks would say, well, we need more private options. We're still the first line guys, that show up, and we have to make sure that we're hiring, people that can deal with these individuals and training them, supervising them correctly. And then, but we also, we have to be open to change, so like in this case, being open to collaborating with somebody, where you can, you have to be open to those suggestions and the possibilities. And then, on another note, and it probably to a certain extent outside of the industry gets forgotten, but, our folks are part of society as well. And we all, we see and do things, that happen that, a lot of people don't don't necessarily see on a repeated basis. So we have to look out for our officers, our staff as well,
Mm.
and provide them with the resources so that they can keep doing the job and do it well. And, understand that it's okay to not be okay.
Right.
If you need to talk to somebody, you need help, go get it. Doesn't make you any less of a person or an officer. And that's kind of keeping both those things in mind is important.
Yeah, for sure. By the way, as we were speaking, I found that stat I referred to. Estimates vary, but studies and analyses consistently show that mental health or substance use related calls make up a substantial portion of police work. These calls often represent between 7% and 20% or higher of encounters and calls for service in various jurisdictions. That's pretty amazing, no?
Yeah. And I would say that, again, most people probably don't interact with police officers that often outside of, you walk past one in the store and they say hello or
Right.
something. You don't, unfortunately, usually when you're dealing with us, you don't call us over to your house just to give us dessert. You've been the victim of a crime, or somebody is making a complaint about you or something. You're dealing with traffic and you are involved in an accident. So unfortunately, a lot of times you associate police with kind of negative feelings sometimes and that. So yeah, I'm not sure of the numbers, but we definitely deal with a lot of substance use and mental health issues, and that has definitely, I'd say, increased over the last 5-6 years.
Yeah, again, to your point, most people associate law enforcement with crime fighting, responding to burglaries, traffic stops, violent incidents, et cetera, which is why I was really looking forward to this conversation and why I asked you a couple of times if there is a growing perception in your community, particularly about this kind of work. I think it's important that people know that you're doing this kind of work. I think there are, some broader positive impacts that can come of this. And while, yeah, people are not necessarily inviting police officers over for dessert or casual conversation, I still think there are some barriers and there is some miscommunication. And I think this could go a long way just to reframe, that kind of relationship and put law enforcement in a different light where it's not so narrowly viewed and to some extent caricatured.
Yeah. Well, in Edwardsville too, we are fortunate enough that we still have a DARE program. So we still have a connection with youth, and many people, whether they're 30, 40 years old, you'll run into, they'll be like, so-and-so, he was my DARE officer. So that connection is really what we try to do. We do a lot of stuff with the DARE program and National Night Out and Special Olympics and that. So we try to create some opportunities for meeting officers outside of, hey, I was involved in a wreck kind of scenarios and that. And we receive a ton of support from our community. And we never go hungry here. There's always people dropping off cookies and donuts and Gatorade and what have you. So, we are fortunate in that respect. And by doing a lot of that, we still live in a community where we're able to be proactive. We're able to take a little bit more time with some of these calls where, some communities, they deal with serious issues that kind of limit their availability, and that it makes it a little bit harder to make those connections. But we've been very fortunate in my career to have a lot of support from our community. And some of that is by our efforts, and some of that's we live in a great community that wants to support their law enforcement.
Yeah, well, I must tell you, Mike, you're doing amazing work, commendable work, and I really do appreciate that. I know you're a busy man, so I do appreciate you taking the time to speak with me today.
No, we appreciate trying to get the word out there and that, and again, for us, we're going to continue to try to do what we can to better our community and provide the best services we can to those who live here and come here, to keep it a good community for all.
Excellent. Mike, again, thanks so much. Today I spoke with Police Chief Mike Fillback, who has been with the Edwardsville, Illinois Police Department since 1996. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.